This is RTP. This is RTP180.
Hi, everybody. Thank you. First of all, I just want to say thank you so much for being here tonight. I know it's a sensitive but impactful topic, and I hope you learned something from every single one of us. So just to get started, like he said, I spent 5 years in New York. In addition to hospice and palliative care, I did sickle cell, bone marrow transplant, and oncology, in addition to palliative care and hospice care. So all the fun stuff, I was involved and I was right there. If you ever get a chance, Mount Sinai is a beautiful hospital on the Upper East Side of Manhattan, and just a beautiful organization. I like to start my speech with a quote from a book called The Tibetan Book of Living and Dying. And if you're looking for a page turner, please look somewhere else. It is not that. But the basic concept that I want you to take away from this book is we treat newborns like they need everything in the entire world. We need to support them, to comfort them, to hold them. But for some reason in our culture, we treat dying patients very differently. We distance ourselves. We keep away from them. And it's kind of a point to make that nurses and medical staff kind of step into that role in some cases and really fill that gap to help a patient die with composure. And die with composure is what I want you to take away from that quote. So if I was to ask you all to close your eyes right now and picture your perfect death, I know, such a happy topic. But if you were to close your eyes, I'm sure you would be at home, laying in bed, holding your loved one's hands. You know, you feel your last breath coming on. You say this very insightful thing that for generations they talk about, you know, Grandpa Justin said this on his dying breath, you know. And that's great. And some of you might get that. Some of you might have that opportunity. But unfortunately, there's a large gap between the percentage of patients who do want to die at home and those who actually do. And that 60% gap is where hospice and palliative care really comes in. There's a lot of turmoil, confusion, stress, anxiety, pain, and we are there to help comfort those patients in basically the worst moment of their entire life. Now, there is a difference between palliative care and hospice care, similar to the effect if I said I was from Raleigh-Durham. Yes, they're very closely related, but there are differences. Palliative care, hopefully you can see it through the light here, but deals with terminal and non-terminal illnesses. So a patient who has sickle cell can have a palliative care physician monitor their pain management for 10, 15 years. It doesn't have to be a terminal illness. In addition, any stage in the disease is when palliative care can intervene. From the day you're diagnosed to the day you die, palliative care can be there. On the opposite end of the spectrum, hospice care demands a 6-month terminal illness for intervention and excludes curative treatment. Now, what they do share in common is the sense of providing comfort care, reducing stress, and relieving psychological and physiological pain. Another way of looking at this, if you were to say from the moment of diagnoses to death and beyond, curative care and palliative care kind of take an opposite approach. They are working together, but you will get to a certain point where curative treatment doesn't make sense anymore. Whether you're focused on quality of life or not, hospice will intervene and take over. After a patient passes away, we are not done with the family. There is death and bereavement treatment that happens afterwards. We really do follow up with these patients' families and really take the time to know their story and know what they need. A lot of things that we do in palliative care, personally, I would like to point out pet therapy. We had the cutest dogs, and they were amazing, and it was so great because I'm a dog guy. It was fantastic. But the real one that I want you to focus on is the second one called doula services. And they're trained companions that really give the patient's family the opportunity to take a shower or go eat or leave the floor for more than 5 minutes without worrying that something's going to happen. And these trained companions are there to hold the patient's hand, to talk to them. There's a big misconception in patients that are passing away that they can't hear you, they can't understand you, they're just laying there. And the sense of hearing never leaves a patient. They may not be able to understand the words that you're saying, but they understand, we're social creatures. They understand that someone's there with them and someone is holding their hand. We've seen it reduce blood pressure, stress, anxiety, lower the respiration rates, just someone who's there. And those doulas are godsends. Those people are phenomenal beyond words. And if you're a doula, thank you. I appreciate it more than anything else. And finally, I'm not reinventing the wheel here. These are all things that you probably saw on like a BuzzFeed, like top 10 things that people regretted at death or whatever. But basically, it's just a reminder to, live every day. Tell your loved ones you forgive them. Let someone be forgiven. Tell them you love them. Just be in the moment and really spend your time with the ones you love and focus on what's important in your life. And with that, I just wanted to say thank you. And if there's any questions, I'll take them.